We often see that many pregnancies after IVF treatment are very badly managed. Now, this might seem surprising. Hey, what's the big deal about managing an IVF pregnancy? It's just like any other pregnancy, isn't it? And the reality is that is true for about 90% of all IVF pregnancies, which means once the woman misses a period after the embryo transfer, you do a beta HCG, you repeat the HCG every 3 days, it keeps on rising, crosses 1,000, you do an ultrasound scan, see a healthy intrauterine pregnancy, and refer it to an obstetrician, and that's fine. But not all IVF pregnancies end up so smoothly, and about 10% of them there will be issues. In about 1% of pregnancies, you will have what is called an ectopic or a tubal pregnancy, where the pregnancy is not in the uterus, it's in the tube. And in some pregnancies, they will end up in a miscarriage. And the problem is just because you've done IVF, the risk of a miscarriage doesn't reduce. It remains the same as it is in any other pregnancy. But obviously, the heartbreak and the trauma is enormous. Now, the difference is that when you're having sex in the bedroom, you usually don't bother to go to the doctor until you're 6 or 7 weeks pregnant. Whereas after IVF, you start doing the pregnancy tests the moment you missed a period. As a result of which, there's this huge gray zone area where the HCG test is positive, but the HCG hasn't crossed 1,000. As a result of which, the ultrasound doesn't provide you with any useful information. But unfortunately, many doctors are very poorly informed and they start doing ultrasound scans very early and they don't see anything, and then they either worry the patient or they label this as having an ectopic pregnancy, or sometimes even though the HCG is more than 1,000 and they don't see a sac on the ultrasound, they should actually call this an ectopic pregnancy, but they don't realize that. And this is a problem, and often the patient gets trapped between the sonographer who's doing the ultrasound and the clinician who's measuring the HCG levels. But the reality is you need to put them both together. You need to correlate the two. And this is why it's important that you have a well informed IVF doctor, and equally important that you be well informed so that an ectopic pregnancy does not get misdiagnosed. And on the other hand, you don't do unnecessary ultrasound scans and waste your money when the HCG level is very low and the scan will not provide any useful information.